have around 10 to 15 minutes for discussion. Anything else somebody else observed? And if you want to add something in the year 2009.
Regarding the new HIV guidelines, because I am looking after exclusively HIV medicine. So, sir, actually, stage 3, when we start treatment less than 350, CD4 count less than 350, not only pulmonary tuberculosis is important, because most of the patients we see here in LNJP and other centers in ART, that people, they don't actually exclude the other form of tuberculosis or other conditions which falls into stage 3. So we have to see whether these patients, they are fulfilling the criteria of stage 3, and if they are having the stage 3, then we can start. Second thing is, ART should be start now stage 4 is less than 250. So earlier it was 200, now it is less than 250. And most of the patient who is having a stage 4 disease, they are having other OIs also. So once anybody start the treatment, we should observe the actually iris or other complication, because there is reversed immune response. And when we start the ART, maybe within few days or few weeks, patient may develop severe infection, or there is a exaggerated immune response or exaggerated existing infection is there. Any question regarding HIV if you have, or H1N1?
If you can see this slide, this is the live webcast. I've just connected to the site docconnect.com, and this is how you can see, this is how the slide appears. There's a video, there will be slides, and everything will appear there. So people can watch this, you can go back, and whosoever has come late, they can go back in the evening, go to docconnect.org or emedinews.org, and you should be able to see whatever you have missed today. You should be able to rewind it and watch it. Okay, please. HPV virus vaccine. Anybody who is aware of that? Any guidelines which have come? This is a new vaccine which has come in India also. And this vaccine, I don't have the slide with me at the moment for the guidelines, but the guidelines are available. So for prevention of cervical cancer, this vaccine should be used. We will have a gynecology section in the afternoon. They are going to cover it. We have a couple of gynecology sessions, and they are going to cover that particular session. Okay, yes, please. Please come here in the front, take the mic, speak out. I want one volunteer here, जो mic take लोगों को, एक यहाँ पे रहे. One mic, the audience mic. Audience mic, ले लीजिए. Any guidelines which have come? This is a new vaccine which has come in India also. And this vaccine, I don't have the slide with me at the moment for the guidelines, but the guidelines are available. So for prevention of cervical cancer, this vaccine should be used. We will have a gynecology section in the afternoon. They are going to cover it. We have a couple of gynecology sessions, and they are going to cover that particular session. Okay, yes, please. Please come here in the front, take the mic, speak out. I want one volunteer here.
Sir, your views on short-term medical course, that is PM.
My views on short-term medical I think my views will not matter. The fraternity as a whole will need to decide whether we want it or not. There are mixed views coming at the moment. There are plus points and there are minus points. The minus points I can narrate. One of the minus points will be that 4 or 5 years from now, they will go to Supreme Court and say, make us at par with MBBS. 5 years from now, they will go and ask the Supreme Court, allow us MSMD. And if you can't allow us MSMD, create MSMD into rural medicine and rural surgery. These problems will come. These problems will come. These problems will come.
Sir, when quakes are practicing in metropolitan cities, who will stop them?
I have no answer. I have no answer. I have only said this is what has happened in the year 2009. I'm not debating here the BRMS because this is something the fraternity needs to decide. Write your views to Emedinews, we'll publish them and we'll send it to the people because otherwise everybody will like to give a comment on that. Everybody will like to give it.